It is Monday, April 13th. Joe Delaro Nujats. Welcome to today's COVID-19 Task Force Daily Update. It is a holiday for many. It's not the best day to enjoy, but hey, it's a holiday for some, but not everybody. The task force did meet this morning, and there are a few things to report, so we'll get things underway immediately with the Executive Director of the Cavalry Memorial Hospital Centre, Lisa Westaway. Lisa?
Thank you. Good afternoon. So this weekend was a busy one with new directives regarding long-term care facilities, Elders Lodge and ILC. So I thought that I would share some of those directives with you. And the impact, because we talked last week a little bit about the fact that the ministry had announced in the media that they would be testing every resident in long-term care facilities, every worker. That's not quite the case. So I'm going to present to you just a summary of some of the changes that have happened over the weekend and that will be implemented. And remember, these changes are as of April 11th, I believe, or April 12th. Some are the 11th, some are the 12th. What we're seeing is that there are new directives being issued on a regular basis based on assessment of what's happening within Quebec, of research and assessment of what's happening elsewhere. And so like we consistently say, these directives change on a regular basis. So as of this weekend, these are some changes that have come about and that were already that are already being implemented in all of our facilities. So the first change is that there will be no transfer of COVID-19 confirmed patients to KMHC. So that's so one thing that we've explained in the past is that we're in preparation for possible positive cases within our inpatient. We've created a COVID positive ward. We are not using that. We have not had to use it. We don't have any positive cases at KMHC. But on that ward, we had originally looked at the possibility of transferring possible positive cases from the Elders Lodge. So in the new directives that have been issued this weekend, it clearly states that there should be no positive cases transferred from outside, from any outside location into a long-term care facility. So we'll be implementing that immediately. There also will be no transfers from hospital settings into long-term care facilities. At this point, as of today, whether they're positive or negative, there will be no transfers from a hospital into a long-term care facility. This is a new directive. As of last week, we did not have this directive. We were able to transfer from hospitals into long-term care, but as of this weekend, we are no longer able to. So that doesn't mean that we cannot transfer COVID negative cases. So right now at KMHC, we do not have any available beds. If we did have an available bed, we would be able to transfer cases from the community who are either at home, at the Elders Lodge, who required an increased level of care if they are confirmed negative. So before we would be allowed to transfer such a case to one of our KMHC beds, there would have to be a COVID test done with a negative result. And the person that was transferred to KMHC would have to be in self-isolation, complete actually quarantine for 14 days once they come into a bed. So that's something that I wanted to just clarify so that you're aware. Any COVID positive cases at home or within Elders Lodge or ILC are expected, their rooms actually then become their hot zone. So their rooms become the COVID positive zone, and their rooms will be completely isolated and quarantined with contact precautions and all safety precautions for people who are going in and out of those rooms to provide care. And it's only should there be a need, a deterioration or a need for alternative levels of care, that COVID positive cases may be transferred to a COVID positive unit within a hospital setting. Another change that's happened is there are a few changes regarding infection prevention and control measures. So the first is a step up with training. So Leslie, who you met last week on one of our lives, I think it was on Friday on the Facebook Live, she has already set up training sessions with employees from Elders Lodge and from ILC. So we've had good we work really well all the time with with KSCS and KMHC together, and so those training sessions are being implemented, but and also being videotaped. We have videos. These are things that we've always done in the past, but we are going to redo these trainings. As we mentioned, even for healthcare professionals and people who have significant training, reminders are really important on a regular basis. So that is being implemented as we speak. But what the directives request is not only that the training happens, but that there be specific people identified on every shift that kind of police or observe that these infection prevention and control measures are being followed properly and regularly. So hand hygiene, etiquette, and all of the donning and doffing of the protective equipment is monitored so that we can really be sure to advise people if they're not following the proper measures. And we really urge people to not feel, any type of defensiveness, basically. So, we were trying to create a really open environment where we could just say to people, hey, by the way, you didn't really take off your mask properly. It should be done like this, and the employee's response would be, yes, oh, great, thank you. So that's not always easy, but this is the kind of environment that we need to create so that we're all working together and helping each other. So the other element to have somebody available on every shift is to also identify somebody who's going to ensure that employees are respecting their physical distancing between themselves, not just at all times. So that's something that will be that is being implemented also. Another thing that's being implemented is the monitoring of staff health. So we were already doing that if there was the possibility of cases that staff were monitoring their temperature twice a day, but actually now we'll be monitoring more closely all symptoms related to COVID-19. So there'll be a questionnaire, so anybody who comes into work on any shift within those three environments, so KMHC, Elders Lodge, and ILC, employees will have to monitor their health before coming into work. There are, and the monitoring of staff, of residents' health, mental and physical health has already been taking place. However, in the new directives, it really clearly states that this has to be done daily and that it should be well documented in each individual chart. Other things that were documented very clearly in the new directives, it was always there as a recommendation to ensure that there was communication between the residents, so whether it be KMHC, Elders Lodge, ILC, and the family member, whoever is named in the file as the person to contact in case of emergency. And so I know that has already been happening. We've been calling home. We have been using our iPads as well to connect. We're continuing that moving forward. So if you haven't received a Facebook call from KMHC, we're looking at those who don't have iPhones. How do we implement that? And by Wednesday or Thursday, everyone should have received their first iPad phone call. So FaceTime, so that you actually can see your loved ones as opposed to just speaking on the phone. So that's become a directive that's especially important, so much so that the ministry has asked us which employees are doing the calls to families. So we've had to give those names in very specifically. Other areas that have been, other directives that have been implemented is to reduce the number of staff that are in contact with one resident. So it's not that we're reducing the amount of staff within our establishments, but we're reorganizing how our staff members work so that they are so that your loved one will always be working as much as possible with the same individuals, as opposed to having a rotation of staff coming in and out of their rooms. So that's really important. Another thing that we're looking at, and so that we have a clearer picture, is of where people work. So we have some part-time staff who are working in more than one establishment. We're going to try to minimize that as much as possible, and so as much as possible, so while being able to maintain appropriate services and resources to your loved ones. So we're in the process of really having a better idea of where people are working and ensuring that nobody is coming into the establishment to work in inpatient who could potentially be in a risk situation in another environment. So those are all measures that are being implemented immediately. So again, these measures are really, much stronger measures that are coming on the back of some of the things that you've seen in the media lately, some of the horrific examples that we've seen of really, really sad cases of death and mistreatment in many private residences across Quebec, a few that have been highlighted quite a bit in the media. And so I think that these measures are being implemented to try to decrease that as much as possible. There are other measures that may not affect us as much. There's actually an investigative team that will be identified to work with the different CISs or CUSs out in the healthcare establishments outside of Kahnawake to actually go into each of the private residences and inspect. So we will not be in this situation, but if we did have any need to have an inspection, we would have access to inspectors who also have training in infection prevention control and could make those recommendations for change. But again, as we spoke about last week when Leslie was here, we are really lucky in all of our establishments because we have infection prevention and control specialists. We have training that happens on a regular basis. We have, and this morning Paul Grafe asked me a question. He asked, what is it that's different at KMHC than at these other private residences? And, I spoke about all of these measures that we have, these, the fact that our ratios are higher than elsewhere, the fact that we have infection prevention and control, the fact that we are smaller and we have the ability to make changes and monitor what's happening within our environment. But I think something that I failed to mention that is especially important is that probably 80% or more of our staff are actually from Kahnawake. So we have people who are working in our establishments whose family members are living in our establishments, whose aunts and uncles our employees have a vested interest in ensuring the safety of our community. And in fact, you can't ask for more than that. It's personal. It's not just, oh, I'm coming to work and then I'm going home. We're extremely lucky here to have personalized care to our elders, and I think that contributes immensely to the fact that our elders right now are doing well and are safe. I wanted to lastly, I'm going to change the subject a little bit. We've talked a little bit about the fact that on a psychosocial level that this situation is becoming more difficult for many people, more worrisome, there's more anxiety, more stress. So probably by tomorrow I will have a little package that we're going to place on our website. This comes from the CIUS du Nord. And it's a little package on how to self-manage in this COVID-19 period. So it's based on behavior activation principles, and it's a form of treatment which guides people to plan and complete more enjoyable, important, and meaningful activities to help their mood and enable their empowerment and promote better self-management. So it's really an individualized document that you can work on your own, and it's little exercises that could help you reconnect with what may still be enjoyable to you, important and meaningful despite the situation that we're living. So there are different elements, for example, that allows you to write down what are enjoyable activities, what are some ideas of things that you can do despite the situation that we're living, and looking at also what type of new activities could you add into your day-to-day list? How do you stay connected to life? How do you stay connected to others? There are elements about feeling useful, about taking a step back, elements like regaining strength and being secure. And they give examples, but of course this is personal, so it's up to you about what ideas you might document and what things you could implement to help yourself. And they talk a little bit about brainstorming and exercise and choosing to do activities that are really meaningful and helpful to you. And to be careful not to want to overachieve, so not to put this pressure on ourselves that because we're home we should be, doing everything and getting everything done. That's not the case. So really the idea behind this is to be kind to yourselves and to really reflect and think about what can you implement that is meaningful and enjoyable to you. So I think this is a really interesting little document. It's something easy that we can all have access to. So I'm going to make sure that it's on our the KMHC COVID-19 website for tomorrow, and you can download it as you wish. So that's it for my update today. I wanted to just say thank you and keep strong. We are going to get through this. We have another few weeks that are difficult ahead of us, but I really urge you to keep up the great work and maintain the measures that we've implemented. Thanks.
Thank you very much, Lisa. And with all of the things that people can be doing, I have a feeling that a lot of people who've been threatening to write that novel are finally going to have time to sit down, and the publishers are going to be having a fun time when this is all over, trying to sift through all those manuscripts that come in. There's so many things that you actually can do during this time. I just wanted to mention something when Lisa was mentioning about the patients at the Cavalry Memorial Hospital Center, with all of the promotion that we're doing to try and help keep people heading in the right direction here. Some of the patients actually took part, and I don't know if you saw it. There was an ad in the papers this past week, and it's just a wonderful ad. You can also see it on the websites, but if you haven't had a chance, and pick up the local papers, and you see some of the patients with the signs in front of them, and they're all giving the positive messages that need to be out there. So that one really touched my heart, and if you see it, it'll probably touch yours. Joining us now is the Commissioner of Public Safety, Lloyd Phillips, the busiest man in Kahnawake, as I call him, and he's here once again to bring you his update. Lloyd?
Thank you, Joe. Thank you, Lisa, for your update on a lot of the new directives that are being implemented at Cavalry Memorial Hospital, as well as going to be equally as important and implemented within the Elders Lodge in our community and ILC. Again, those are some of our most vulnerable people in the community, so obviously we want to make sure that they are as safe as we possibly make them. And a lot of this information, as you mentioned, is based on new data, on new science that's becoming available as this pandemic progresses. We all know it's a new virus, that the way it behaves and the way it evolves, there's a lot of question marks there, but the longer this goes on, more and more of these answers are being determined by the scientists, so that makes us adjust our measures accordingly to ensure that we're using the most up-to-date information possible to make the decisions on behalf of the community. And also, some of the stuff that we see happening, within the larger Quebec picture. Quebec, I think, is starting to feel the pressure on the healthcare system, so they're looking at modifying the way they're approaching things to ensure that when that peak does get here, that they are able to handle it as best as they possibly can. The task force met today. We had a good discussion this afternoon. Again, just largely based on a lot of the updates in each sector in the community to ensure that all the areas are covered off. And again, I'm just glad to report briefly that things overall are going well. All the key sectors are maintaining. Everybody's looking at contingency plans for what's going to happen down the road in the next couple of weeks. As we said, that peak of this wave is coming in the next week or so. So we're all looking at what that's going to look like for impacts within our community and preparing for that. But also in the weeks beyond, what happens in week 3 and 4 down the road, and what do we need to do to prepare ourselves for that. There was also some discussion about what happens after that peak and what happens after some of those numbers start to drop off. How do the measures evolve? Do we look at how do we start transitioning back into normal, for lack of a better word? But just to let you know that, some of that discussion is taking place, but I don't want to jump ahead of ourselves as well. I don't want to say, put a date on it or give the impression that we're through the worst of it. But just to let you know, those are discussions that are taking place on how things are going to look down the road. And as Robin Dallaron was here yesterday speaking about education, she's even looking into September on how this may impact the students. So a lot of long-term planning taking place. How do we get back to normal? But let's take it one step at a time. That wave is coming. It's looking at peaking sometime, and I mentioned before, around the 18th, 19th of April. How long we're going to maintain that peak is still a question mark until, we start having that downward slope. And how we weather through that all depends upon the reaction of our community, the response of key organizations in the community, and directives by the task force. So again, collectively working together as a community, is the way that we are certainly going to get our way through this pandemic. Hopefully, like I said before, and I don't mind repeating it, looking back and saying, we took proper measures and we came out of this very well as a community. With that said, it's been 4 weeks officially since the pandemic was officially declared. It seems much longer to some people, and we understand that the impacts on people, the psychological impacts on people, and the stress factor on people, and anxiety is increasing. Because when we first talked about taking measures in the community, and shutting down certain non-essential businesses and all the different other things that we have been directing or asking people to do, most people are willing to comply, to a certain time frame, and say, okay, I could put up with this for the next 2 weeks, 3 weeks, 4 weeks, but beyond that, it gets kind of difficult for people to keep looking at the unknowns. But unfortunately, we're not at that point where we can give anybody a clear estimation of when measures will be able to be decreased. Even watching, we watch the news all the time here at the task force. We have it on and making sure we're hearing what's being said within the province of Quebec, what's being said Canada-wide, what's been happening in the States. And even then, there is no clear answers, that any of the people, I guess pretty much in North America, can't put a definitive date on that. There's some wishful thinking and some optimism because certain people are saying there's a light at the end of the tunnel, which I believe there is. But let's just take it, certainly that one step at a time. And as I said the other day, if there's any time now where the measures have to be adhered to, now's the time. We're at that crunch time. That wave is coming. So if we buckle down hard now, I believe, in a few weeks' time, we may be having a different conversation and looking at the next phase of this pandemic. So just a reminder, again, the simple things, because like I said, there is no treatment. There is no treatment for the coronavirus, as we all know, but there is, in a way, a treatment, right? And that's what we've been saying time and time again. Simple things as washing your hands, that physical or social distancing, keeping that distance from one another. Stay home as much as humanly possible. Only go out for essential services. And we're asking people, please stay in town as much as you can. If you can shop Kahnawake as much as possible, great. If you have to go out of town, coordinate your efforts. If you have to go to a supermarket or wherever you gotta go, make sure you coordinate it so you're out for the least amount of time, exposing yourself to the least amount of people as possible, before you come back to the community. Again, that's something that it's on a personal level, but your actions definitely could impact, the entire community in one way or another. Just another reminder, and actually it's a directive for all staff within the community. When you get home, that you are supposed to remove your clothing, at your entrance, bag it, take it downstairs or wherever your dryer is or your washer, wash it immediately, or at least throw it in the dryer for 30 minutes so that the heat in the dryer is enough to kill the virus. And it's certainly highly recommended for anybody who is out and about in the community doing your essential tasks. When you get home, change your clothes. Throw them in the dryer, for that 30 minutes, and then fine, you can put them back on. But that 30 minutes, could make a major difference so that you're not spreading that virus throughout your home or to, unfortunately maybe to somebody else. So take those extra measures. I think it's very important. A simple task like that could certainly go a long way. Just a couple other points, just to remind the community and also remind the people who are staff of one of the major organizations in the community. We are fortunate in the sense that we have people who are working for the community, but those people are also subject to being redeployed into other areas within the community. We have an agreement amongst all organizations in the community that if one organization needs assistance because of staff is either out sick or they need a break or whatever the case may be, we are going to be moving staff around if it's required and if it's deemed to be necessary. Staff from one organization may go work into another area, or if there's a needs to help assist in food basket, for example, we'll take staff from various areas to assist as much as we possibly can. That full community, the community effort is what we certainly need. This morning, I had a discussion on the radio along with Lisa and Paul Grafe, and he asked me about how I view the measures being taken over the long weekend. And I generally by observations and looking around, and see a lot of people are certainly respecting the social distancing, physical distancing. Like I mentioned, I was on the island, and a lot of people out there walking around, getting exercise, fresh air, which is good. It's good for the body, good for the soul as well. But afterwards, I did get an update from Chief Peacekeeper Dwayne Zachary, and he said that unfortunately they were called to a few places where people were getting together, as extended family, and having an Easter dinner or whatever, and they had to show up there and ask people to please to disperse. And it's unfortunate, but it did happen. Again, people, we're asking, just so people if we're not clear when we say about your family, we're talking about the family unit in which you live in. The people you live with on a day-to-day basis are the group of family members that you should be with. You can't go next door and say, well, I have, for my case, I got my brother living right next door to me. I don't go over to his house and visit, and he doesn't come over to my house and visit. We may talk across the yard, and that's we keeping our distances and respecting the family unit. Somewhere down the road that may change, but right now, at this crunch time, we need to reinforce that message to the people. It's the people who live in your home that are the ones that you should be in contact with. And if you're outside, that group or that bubble of your immediate family, that's when make sure you're keeping that physical distancing, and that way you minimize the chance of bringing back that virus, to your home and possibly infecting other people. As a last note, I know we are here, talking about the same measures and talking about some of the similar stuff over and over again, but I think it's important to repeat ourselves, because at this point, 4 weeks in, with a question mark on how far, these measures will be in effect, is stressing and it puts anxiety on everybody. And believe me, it puts anxiety and stress on the task force members themselves. Because as equally as we are fighting the virus, we're fighting a psychological battle as well. So keep that in mind. We're all in this together. We're fighting a psychological battle because of a lot of the unknowns and the pressure that we're all feeling because of the measures that are put in place. But those psychological battles is what's going to, by defeating those battles, is what's going to help us defeat the virus, and help keep our community safe. So with that, everybody, see you soon. On the way.
I thank you, Lloyd, and thank you, Lisa, and thank you, everybody who's been watching today. There was a lot to update, actually, on what is normally a holiday Monday, so I hope you got some information that you could use, just a little bit more information. For those who are interested in the testing over at the Cavalry Memorial Hospital Center at the COVID-19 test facility there, you can call in the morning. It'll open at 8 o'clock. Testing begins at 11 o'clock, runs until 4. And for appointments, you can call 638-3930, and the extensions are either 2296 or 2275. And again, you can catch that on the websites. You can go to covid-19.kmhc.ca. There's lots of information there. And of course, just watch these updates. You can catch them later on as well on Paul's Cable. They've been on, I have to tell you, within a couple of hours of this live show here on YouTube, not YouTube, sorry, Facebook, but it's on pretty quick. So if you want to watch and get more detail, because sometimes you gather up more information on second viewing, you're certainly welcome to do that. In the meantime, take care of yourselves, and we shall see you tomorrow with our next COVID-19 task force update. On behalf of everyone here, Kahnawake, tano, onigiwahi.